My name's Tsorbaris, and I'm here today with Dr. Lisa Griffiths, and we're here to talk about International Women's Day and achieving an equal future as a consequence of COVID-19 and what we've all been through here in this country. So welcome, Lisa. It's lovely to be chatting with you today. It's a very special day, International Women's Day.
Yes, it is, Deb. Thank you very much. And it's really exciting that we both come together, of course, on Aboriginal land here in wonderful Australia. And I'd like to pay my respects to the elders past and present and elders emerging and acknowledge all the wonderful Aboriginal colleagues we have across the sector and around Australia. And it's really important, an International Women's Day. As you've noted, COVID has been a really interesting experience and had an impact on us as leaders and women in the sector. And I'm really interested in your role in leading and representing our sector throughout COVID-19 and what you have chosen to challenge on.
Wow, that's a great question, Lisa. I also want to acknowledge I'm on Wurundjeri land here in Melbourne, beautiful Wurundjeri land. I mean, it's hard to put a word or more than, it's hard to put a word to what we've been through over the last 12 months. But in many ways, your word challenge us, push us, make us bolder, make us more creative. All of those words spring to mind when I think about COVID. So obviously as an advocate, a children's advocate, I'm going to talk about some of the things we need to do now to make sure children don't miss out. But I have seen some of the most incredible, bold, creative, coming together, collaboration, we can do it type attitude over the last 12 months in our sector here in Victorian child, youth and families that I've ever seen before. I think in some ways it's allowed us to do the things we've never been able to do before. I'm proud of what we've been able to do. Creating online communities, answering the questions, helping the department, developing intel, getting the resources we need, but really coming together to solve problems that probably we could have never imagined we needed to do. So Lisa, there's lots that we can talk about from 2020, but leading us into 2021. But how do you think the workforce in our child, youth and family services sector has coped and responded in this last sort of 18 months? What have they done? What have you seen? Have they impressed you? Where are the gaps? What are your thoughts?
Well, we know, Deb, that the people that work in our sector are so purposefully driven. I mean, they're incredible, as you often remark, and we're very, very privileged to work in this sector, and it's incredibly hard work. But it's now been 12 months since we had this massive disruption to the usual way of working. And I think probably the first thing that impacted us all was having to come to grips with the fact that we're a very relational sector and that we do a lot of our leading through relationships and a lot of our influencing and our advocating, as you shared. And having relationships under COVID conditions, be that via technology or behind a mask, probably impacted for quite some time. I observed in our teams the way they came to grips with that. In fact, I had many conversations with leaders about whether they felt they could still be as effective, given that they weren't in person sometimes with the people that they wanted to support. And of course, that's right down to our frontline staff too, and supporting often our foster carers and our children that were under lockdown conditions. And of course, our workforce and the centre has done a range of censuses over the years about the demographics that work in our sector, and it's still largely made up of women that have children of school age, and that goes into sort of 70-80%, I think, Deb, from the last census that the centre did. And that means that a lot of our primary workers were becoming master jugglers because they obviously had their day jobs to do. They were then working from home. Most of them have got school-age children, which then meant that most of them became teachers. And how they were able to navigate all of those things was quite incredible, because I never saw that we missed a target in terms of the supports that my particular agency delivers. They kept on top of delivering all the services that they needed to do, be that via telehealth or be that in person, knowing that we were under really strict lockdown conditions for 112 days straight. But they didn't skip a beat in terms of making sure that children and families that were experiencing real vulnerability got the supports they needed, because those challenges for those families never went away during COVID. So, and we've seen around the world as well the broader impact about racial inequality, family violence, and I still think that that's going to play out a bit in our sector as well.
I mean, I'm just really feel very privileged to work alongside the workers in our sector who've done such an incredible job. And I think you're right, Lisa. We heard stories of workers standing at the front gate of people's homes and handing over data packs and food and games for children and whatever people needed to keep that social distance happening, so that people were still providing services, being able to see, talk to mum from the front fence. I mean, remarkable. And just sort of shows what we're made of. But you see, we're the community sector. We're embedded in place. That's what we do, hey?
And from your perspective, Deb, how do you think, your leadership of the sector has changed because of the pandemic and these new working conditions? Because you're very much a relational leader and out in front of people all the time. And but we've got this wonderful many members that belong to the centre. What are you doing differently now as a result?
It is, it's really interesting because we're working in a different medium now, and I've had to get used to working in a different medium. And I quite like it. And the reason I like it is because as a
Your laundry?
well, I sort of like it because we get to more people. We get to create communities that are more democratic and inclusive. I get to see workers and managers and CEOs across the screen that I would probably not even see, maybe see once a year, but I get to see them every couple of weeks. We get to have a closeness and a connection that I couldn't have imagined that we'd be able to have as a peak body and a bunch of collaborators on key issues. So for me, it means as a peak, we touch more people, we bring more people together, and we stand more chance of being able to solve the problems that we're trying to solve because we've got more of us coming together to talk about them. So, and I am, as you say, probably very relational, but somehow through this medium, I've managed to be able to continue to be that way, and try and keep people engaged. So it's funny how you can make that switch. But I have to say, more people, more contact, more advocacy, more ability to have collaboration. That's the upshot for me.
Yeah. And the centre has been such a conduit in that space. And my observation would be so much more information is being shared. So many more people can access that information. You can get it readily in a dynamic environment. Many people wouldn't have been able to ask questions of yourself as the CEO of the centre, or of Aguirre, the deputy secretary, yet the centre is, through this medium, has been able to pull and draw down on all of its expertise. And then what I've observed, that you'll have a number of people gain their voice, because they can gain their voice through using the chat function.
Yeah.
They can put their hand up. Normally in a meeting, you look a bit silly, don't you, if you're in a room full of 50 people putting your hand up for a question because you're a bit embarrassed. But in a medium like this, where you get a little yellow hand going up, then it's a bit easier, isn't it, to engage with leaders that can be quite daunting when somebody like you, who's a public face, might be as approachable as you are. It's probably been a lot easier for people to sort of ask some questions that they couldn't ask before.
It is, and I think that I sit across the screen with people who I would normally not talk to, and they know me now, and they know they can make contact with me. But also our funders, very early on in the pandemic, it was chaotic. It was chaotic, and it gave them a place to come to get intel, ask questions, take a temperature pulse, get our ideas for solutions that might work. But you're right. I mean, we pride ourselves on being the single source of truth when it came to communications on COVID, because there was a lot of information out there, and we really wanted to make sure that people we work with got what they needed when they needed it. I must say, early days I was worried how we would do that, but we seemed to be able to do it, which was fantastic.
Yeah, and the demand just gets higher and higher for that now, doesn't
It
it?
does, it does. Now, Lisa, I might ask you a question now,
Sure.
and I think that this is really at the heart of what you and I, this is why we come to work in the morning, and this is really about, how do we see the world, the post-COVID world? We're not quite there yet, but there are some issues for children and families and carers and young people as a consequence of COVID. So, what do you think families and children and carers are going to need as we sort of slowly move out of something that I never imagined I would experience in my lifetime? There's been sadness, there's been way too many people die, lots of people get sick, um, and some people have done very well, but there are lots of people, lots of children who we're quite concerned about now. What do you think we should be doing? Where would you see we should be focusing, and what do you think some of the issues are?
Well, you know me pretty well, Deb, and I always like to go to the research and see what the data and the evidence is telling us. And there are very, very clever people out there that have been beavering away, looking at the impact on what COVID-19 has done to place vulnerable children at risk, and what does that mean in terms of our future approaches. And in fact, just last week, a paper was released by Herenkol et al., which is a group of Australian researchers, but they did some worldwide research. And they were arguing that for us to succeed in ensuring the safety and well-being of children, we must do all we can around the world, of course, to flatten the curve. And we've learned that term, didn't we, right at the beginning of COVID, that we need to do that, because obviously that's the only way you can kind of bring the pandemic under control. And I think we have seen the inequity that the pandemic has dished out depending on where you've been in the world. And I think we've had some tough conditions here in Australia and in Victoria, where you and I are today. But we probably appreciated that the decisions that were taken by our leaders in this country were very much driven by the data, very much driven by the evidence to flatten the curve so that we could have the most equitable chance of returning to a COVID normal. But so whilst we have to seize the day, carpe diem, around the public health prevention efforts, I think we have a big lesson that public health approach equally applies to working with vulnerable children and families. Abuse and neglect is as much a public health problem as family violence is a public health problem. It's a mainstream problem. And if we see abuse and neglect of children as a public health interest, then we can start to target our interventions at that, with the primary goal of preventing new and reoccurring cases of abuse and neglect. So the pandemic taught us that, we all went into lockdown, and what we saw in the data was the number of reports of abuse and neglect and notifications to child protection agencies slowly dropped down, and just sort of because, for obvious reasons, kids weren't at school, so some of the main reporters, mandatory reporters of abuse and neglect, are our teachers and our first responders and our police officers and the like. And once we have now come out of lockdown, we have seen steadily that those numbers are creeping back up again. And we're all anticipating this sort of huge demand that's going to come behind, because we also know that job seeker and job keeper will be changing. We had the really sad news this week that JobKeeper and Job Seeker is not going to remain at its levels that it fundamentally should be. It's only increasing by a marginal amount. And that's going to put real financial stress on our most impoverished families. And often what that does is leads to, a whole range of behaviors in families around drug and alcohol abuse, family violence, and that in turn leads to abuse and neglect. So all you have to really go back down into the preventative end to sort of understand what's going to happen when you remove some of these safety nets for children and families, such as income equality, such as, a really equal approach to public health. Now, we do have that in this country, but we've still got a long ways to go to make sure that we provide, the right level of economic stimulus and housing and support, so that we can be really targeted in how we approach child welfare.
So true, Lisa. And I think it is about it's always good to look at these issues from a public health point of view. And I totally agree with you. We did in Victoria what we needed to do. I must say, I've just been reading the UK Children's Commissioner's outgoing speech, and she talks at length about children being left behind, but also about it only really takes a couple of things to topple a family into quite significant disadvantage, and COVID being one of those. And I know that our advocacy over the next couple of years will continue with pace to make sure that we help kids catch up where they might have fallen behind. And I think, that from my point of view, that there's not a more important task than trying to do that over the next couple of years.
Yeah, and so I think there's going to need to be a huge investment into the more primary universal type platforms, because in our sector, we deal very much at the tertiary end. We deal with the most challenging of problems and then the most expensive investments. But there's going to be a bit of a surge of new families entering into that area. So the earlier we can intervene, and the investment in that sort of primary end is going to be really, really fundamental to shift. And we really need to think about the way we use our resources and the way child protection works in the future, if we're really going to tackle what's to come.
Absolutely, Lisa.
And that brings me, I guess, Deb, to ask you a last question, actually, about, we've talked about that, it's International Women's Day, and there's a huge focus, of course, on female leadership. And you have been an iconic leader in the sector for so many, and I know you do a lot of work in empowering female leaders and mentoring female leaders. What advice do you have for future female leaders that are working in our sector?
Sometimes I'm the one that needs the advice, Lisa, but I think I'm very happy to sort of, in terms of my observations of the last couple of years, certainly the women that I work with, it's really, there's a number of qualities that I think shine through. I think that many of the female leaders that I work with in the child, youth and family sector are brave and talk about things that most people in our community don't talk about. You just talked about child abuse and neglect. They're uncomfortable subjects, but many of our female leaders in our sector talk about those things every day. So those issues are heard, and we try and get the responses that we need. So courage and bravery in naming up things that are really difficult to talk about. Very much an important, I suppose, aptitude of many of our female leaders. So that's really important to me, because I think if we're silent, then things don't change. Many of the female leaders that work in our sector are collaborative. And that means it's not always about personal gain or professional gain. It's actually about all of us, and it's about sharing information, sharing resources, and sharing knowledge. And I would say to any emerging or ambitious young female leader, bravery and collaboration are two incredibly important features of, I think, a successful female leader. But it's more than that. It's actually about success of our sector, our system, our kids. When you get a breakdown in collaboration, or you don't get issues named, you really can't go very far. And during COVID, the level of collaboration and support for each other was, I think, at an all-time high. So they're the two things that stand out really. So there are many, many other amazing qualities of our female leaders that I think our young female leaders might want to look to. But I'd also say, get mentored. give us a call. Ask, is there somebody out there that I can talk to? Don't sit back.
And I guess that's really nice sort of segue back to what International Women's Day is about this year, isn't it? And where we've learned so much throughout COVID about the use of data and evidence, and how our future leaders can use that in a very powerful way to increase their capacity for really effective decision making and evidence-based decision making. So it's been fabulous to share a little ditty with you today, Deb. It's always good to have a chit chat, and thank you for all the work you do for all of us in the sector. It's a real privilege to be on the board of the Centre for Excellence in Child and Family Welfare, which is just such a fabulous job. So for all of our members listening today, I really hope you continue to utilise all of the supports we offer you, and if there's anything we don't, let us know.
Thank you, Lisa. I mean, this is a really fun way to spend International Women's Day with you and talk about the things that matter, and and really keep the fight up, because there's still a lot more work to do. We by no means have finished, have we?
No, that's for sure.